Most of patients came to meet the therapist to rid of this sputum. Because of this sputum, it can link to obstructive lung disease. So, what is postural drainage? Postural drainage is a therapeutic technique used to help clear the mucus and secretion from the lung. It involves positioning of the body in a specific way to encourage drainage from the upper respiratory tract.
Postural drainage is an essential component of respiratory care, especially for individuals with conditions like cystic fibrosis, bronchitis, or chronic obstructive pulmonary disease. By using gravity to our advantage, we can help improve lung function and overall respiratory health. So, what is the indication, contraindication for this treatment?
So, indication of postural drainage. First, it prevents accumulation of secretions in patients at risk of pulmonary complications. Okay, next, it removes accumulated secretions from the lung. Contraindication of postural drainage is first, head and neck injury, hypertension, headache, pregnancy, and active hemoptysis.
Me and my team will explain more about postural drainage.
Apical segment. First of all, the therapist confirms the patient identity and explains the procedure of the treatment. The therapist asks and sees if there are any signs of contraindication in the patient. After that, patient should take out all accessories items like a watch, ring, or necklace. Then, moving to treatment, the therapist will request the patient to sit upright on a clean bed with slight variation by leaning forward. The therapist provides a pillow for the patient to hug and support their body to keep in position. The treatment starts with the therapist starting with chest manipulation. The therapist applies percussion for 2 minutes. The therapist makes sure to lock the elbow and relax the wrist to avoid getting fatigued. Later, the therapist did the variation 4 to 5 times at the apical segment right to the middle after the patient exhales, allowing mucus to drain out from the lung. Give patient time to cough or remove sputum. It indicates our treatment are effective.
Then, the same procedure is done on the other side of the apical segment.
For the right upper lobe posterior segment, the patient must lie on his left side quarter to prone and then turn 450 degrees to his face. The patient should place his left arm comfortably behind his back with his right arm resting on the supporting pillow and the right knee should be flexed. The therapist will apply percussion over the upper back to aid in secretion removal for 2 to 3 minutes. Followed by 4 to 5 repetitions of vibration. Then, the same procedure is done to the left upper lobe posterior segment of the patient.
For the upper lobe interior segment, the patient position must be in the supine lying position and they must support the knee with a pillow. After that, therapy will do a cupping on the affected side. The location is between the clavicle and the nipple. The therapy will involve cupping for 2 to 3 minutes. Followed by the 4 to 5 repetition of the vibration. After finish, the therapy will apply on the other side.
Are there any risks associated with the postural drainage? You may vomit if you do the postural drainage after eating. Try to do the position before eating or 1 to 2 hours after a meal. If left untreated, mucus in the lung can turn into the serious condition. So, make sure to follow up with your doctor if you decide to do postural drainage. Get emergency treatment if you have any following symptom during or after postural drainage, such as shortness of breath, trouble breathing, confusion, skin that turns blue, coughing out blood, or severe pain. In conclusion, postural drainage properly applied has been shown to improve secretion clearance in a relatively narrow range of patients with cystic fibrosis or excessive sputum production. That's all from us. Thank you.